You're listening to localwebradio.fm. Community-minded, locally focused.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert, brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, Nick Jaworski here, and I am your host today, and I am here with Dr. Norm Ickert, Director of Ickert Dental Implant Centre, and today we'll be talking about the timing of implant therapy following tooth extraction. We will be discussing the 3 specific times for implant placement, what happens if teeth have been missing for a long time, and factors for considering additional bone and soft tissue procedures. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it is great to be talking with you today.
Thanks, Nick. I always look forward to our time together.
In the last podcast, we talked about the fact that there are at least 3 different entry points for placing dental implants following the removal of a tooth. Would you care to elaborate on this?
Well, as we mentioned last time, there is no way that we can absolutely prevent the bone loss. That is a given. It's genetically predetermined, and that's going to happen no matter what we do. But what we'd like to do then is basically break up the different potential time frames of placing the implant once the tooth is removed. This is important because when we talk to a patient who is interested in an implant, it is difficult to be 100% positive that we can place the implant the day that we take the tooth out. So there are some criteria that we look for to be able to place the implant immediately. So there are 3 specific so-called time frames that we place the implant following the removal of the tooth. One is the exact same day that the tooth was removed. The second would be the delayed approach, which is several weeks after. And then finally, there is the mature approach, which means that the tooth has been removed for over 3 months and the bone and the gum have healed. So those are the 3 specific time frames that we have available.
Would you mind taking us through the sort of the parameters for each of those time frames? What are the contributing factors that help establish when someone might get their implant?
Sure. As a generalization, the immediate implant is the placement that we probably do the least, only because it's determined by the underlying anatomy of the individual. And so the point really is that once we take the tooth out, and of course the goal is to take it out with as minimally an invasive procedure as possible, but once the tooth is removed, we actually measure the thickness of the bone on the so-called buccal or lip side of the tooth. In other words, towards the outside, we measure that bone with a little caliper. And if that bone is 1 millimeter or greater, then that will give us the freedom to go ahead and place the implant with the confidence that the bone is not going to shrink that much that it will create an aesthetic problem for us at the end. The reality is this only happens about 10% of the time. In other words, the science is clear that over 90% of the teeth in the upper front portion of the mouth have bone which is less than 1 millimeter thick. So it doesn't happen that often if you want to place the implant in a predictable manner with a long-term outcome that you like. Now that leads us to the next option, which is what we call the delayed or the early placement. And this option is interesting because what we do here, we take the tooth out, and if we measure the bone and it's less than 1 millimeter, we know that bone's going to shrink. So then we just take the tooth out and just let it heal. We don't do anything else and just let it heal. We put in some kind of temporary restoration so the patient never walks out without a tooth, of course.
Right.
But then we let it heal for approximately 6 to 8 weeks. Now, what that does is really important. That allows enough time for the soft tissue to heal over the site where the tooth used to be. Because remember, there's going to be a hole when you take the tooth out. But in 6 to 8 weeks, that hole is completely closed up with new gum tissue. Now, what that does, that gives us extra gum tissue to work with. It's like a free gum graft. And then when we expose the site after 6 to 8 weeks, we now notice that the majority of the bone that will resorb has already resorbed, so we know what we're dealing with, and then we can place the implant, graft the bone, graft the soft tissue if we have to, but we then end up with a predictable outcome.
Yeah.
So we're not guessing. So the final option is what we call the mature placement, and this is fairly straightforward. That means that when we take the tooth out, there is so much bone destruction at that time due to either trauma or to infection or to whatever other reasons that there just simply is no bone to place an implant. In that case, we just close the area up, let it heal, and then after it's healed, we graft the site, and after about 3 months of healing, then we go ahead and we place the implant. So that is what we call the mature placement, where the tooth has been missing for more than 3 months and the bone has had a chance to heal without any implant placement.
Now, I've seen examples of advertisements where dentists have promised, teeth in an hour or teeth in a day, and that would be awesome. I'm sure that having it done quickly would be preferred by everybody, but it sounds like that it wouldn't be that easy or even preferable in most cases.
Yeah, you're absolutely right, Nick. And you know what? If it could be done, we'd be the most happy people in the world to do it. I mean, that would be the best case scenario for everybody. And it doesn't mean it can't be done. It just means you have to have the absolute perfect situation anatomically to make it happen. And as we mentioned, the science is pretty clear. That isn't really reality for most of us. Because you see, we can't stop that bone loss. It's going to happen no matter what we do. Mm-hmm. And not only does the bone resorb, but the gum also follows the bone. So you lose gum at the same time that you lose bone. And the reason this is so important is that it affects the potential aesthetic outcome. It affects the hygiene. It affects the long-term maintenance. These are all factors that if we don't have a healthy site of healthy gum and bone around the implant, aesthetics and hygiene and maintenance are going to become a real problem. So it is possible to do these procedures very quickly or immediately, but quite often, if you're not careful or if the situation isn't right, you end up paying a very big price, and it's probably not going to be worth it in the long run.
Now, up until this point, we've talked about the possible timing of an implant happening pretty shortly after the tooth, from a day up to 3 months. But what about if a tooth has been missing for a long time? Let's say 4 months, 5 months, or several years.
Yeah, that's a great question, Nick. I mean, that's what we see a lot, where teeth have been missing for various reasons for a long period of time. So we're not talking about teeth where the tooth has been recently extracted. We're talking about mature bone with mature gum tissue. And again, what we have to do is look at the actual anatomical parameters of that site. It's a three-dimensional analysis where we look at the height of the gum and the bone, and we look at the width. And that will determine if we can place an implant. You see, there are many things that lead to excessive bone loss. If the extraction has been, let's say, a little bit more traumatic than expected, you will lose more bone. Or if there has been some type of partial denture or even a denture pounding away on the bone over the years, the normal chewing forces of that denture against that site where there is no bone is going to cause even more bone loss. So there's many reasons why we lose significant amount of bone over time. Or even what happens is that if you lose a tooth, let's say in the upper posterior or back of the mouth region, that is very close to the sinus cavity. And that air pressure from the sinus cavity tends to press downward, making the sinus bigger over time and actually removing more of the bone that used to be there. So you lose bone very quickly in the upper posterior regions of the mouth. So the problem is that you have to decide if you have enough bone to place the implant. The other fact, of course, is there are nerve structures and other anatomical limitations that determine if there's actually enough bone height and width to place the implant in a predictable manner.
Okay, we're up against a break right now, so we'll be right back with Dr. Norm Ickert from the Ickert Dental Implant Centre, and when we return, we'll be talking more about implant therapy following tooth extraction. Lots of great information. Don't go anywhere. We'll be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
Take control of your financial future with sound investing with Byron Stryloff, Senior Investment Advisor and Chartered Financial Planner with over 30 years of experience on the Business Channel on localwebradio.fm.
Shopping for the lowest mortgage rate? Looking to refinance? Catch the Mortgage Newscast with Jared Dreyer on the Business Channel on localwebradio.fm. Buying or selling a home on the Semiahmoo Peninsula? Catch up on local market conditions on This Week in Real Estate with Lance and Connie Marples from Sutton West Coast Realty on localwebradio.fm. To schedule a face-to-face consultation, you can reach Lance and Connie at 604-538-8888. That's 604-538-8888. And visit them online at www.surreywhiterockhomes.com.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, we're back with Dr. Norm Ickert, and we're continuing our discussion on placing implants following tooth extraction and other procedures that may be necessary. Now, Dr. Ickert, how is the site with a missing tooth evaluated?
Well, of course, you can never, ever discount the value of using your eyes and your hands and your brain to figure things out, but it can be very deceiving. I mean, it can look like you have a lot of bone just because maybe you have a lot of thickness to your soft tissue, so it's very deceptive. So we don't want to discount the use of using our clinical judgment in terms of our eyes and our hands, but today, the gold standard for determining a site is what we call a three-dimensional radiograph or X-ray, and it's an offshoot from the CT world, and there's wonderful technology available today that allows us in our dental offices to have these amazing images with this, what we call cone beam tomography, which is, without getting into much detail, but it's basically a type of a CT scan, although it has significantly less radiation than a CT scan that you would get in the hospital. So it becomes very reasonable for us to take these scans and be able to three-dimensionally assess the exact height, the exact width, the exact depth of the bone. We can find out where the nerves are. I mean, it's phenomenal what we have access to. And without this, we really can't be confident, but with this type of technology, we can be extremely confident with the placement of our implants.
That's amazing. Now, we've talked about the 3 time periods for implantation, but how often is a mature site perfect for implant placement without any additional grafts or treatment?
You know, to be brutally honest with you, it's very, very rare that a tooth has been missing for a long period of time will be an appropriate site for an implant without any further hard or soft tissue augmentation or grafting. Now, there's the odd time where that does happen, and that's wonderful. However, the reality is the longer a tooth has been missing, the more the bone is going to shrink, the more the gum is going to shrink. And then we end up with a site which is either not tall enough or wide enough to place the implant. But the good news is that today we have so many wonderful techniques to build up the bone, to build up the soft tissue, that really it just comes down to the patient's personal desire whether they want to have the implant done, because in almost all cases today, we can find a way to place the implants in a predictable manner.
Wow. Okay, so what are the major reasons for considering additional bone and soft tissue procedures?
You know, we're going to keep it brief at this point, and maybe in future podcasts we'll delve into this in more depth.
All right.
for these individual items, but